door and offer these suggestions to the subconscious so that there is no way that they can fight it. It's just, oh, okay, you can perhaps do this. All right. And they do it. And so that's how we use guided imagery. Oftentimes, I'll go a little further and I will offer suggestions in a more strong fashion if there's an emergency or crisis. I can tell you a story about the emergency room where a woman was going to have a procedure on her hand, and she was very, very upset by that. And when I came into the room, she was crying in fear. And so I dimmed the lights. I offered her a little aromatherapy to help begin the relaxation process, started to use some soothing words, got her breath down a little bit if she was breathing rather fast. And as she began to relax, I did some energy work with her and then offered her some suggestions where the procedure was going to occur on the left hand, that her left hand was going to be quite cold and quite numb, almost as if she was dipping it into a bucket of icy slush. The rest of her body was very, very warm. It was covered with blankets, and it was very soothing in the room. But that left hand, she could barely feel it. In fact, it was almost like a piece of dead wood. Well, the practitioner came in at that point and inserted some lidocaine into some of her fingers, and the most profound response that happened at that point was, like that. And she later did call me and say that changed her whole experience and perception in the emergency room, from one of fear, anxiety, and pain to something that was actually more comfortable and something she went home with a much better experience on.
That reminds me of the story that Hatsie talked about with the little boy in the emergency room who was going to have a procedure, and they sat overheaded a pet therapy dog sat to the emergency room, and how that calmed him down. And I can tell you from my own experience, my husband was admitted to Northern Westchester for a couple of days and having just horrible, horrible pain. And I happened to be in the hallway when Charlie, one of the pet therapy dogs, was there, and I asked if they had been in the room. And so she says, no, the door was closed, I didn't go in. And I said, well, would you mind going in? And I can tell you that having the dog go in and my husband pet the dog and just have this conversation with her about the breed was so relaxing and so beneficial that I was amazed, because I just thought, well, he'll just feel better petting the dog, because we have like 3 dogs at home. But actually to watch how his breathing changed and his whole mood also changed, because prior to that, I mean, he was in anguish, but it brought a smile to his face and made him feel better.
And that's the amazing thing, that perception and that change, how it can increase comfort levels in our patients. And that, again, will begin the healing process for them as well. I've gone into the emergency room with the pet therapy dog, and one particular case was a woman who had a blood pressure elevation. She could feel it. Now, she was traveling by herself from Florida up to Maine, and she happened to be in a very bad storm. It raised her blood pressure, and she panicked and did not know what to do. So she stopped at the nearest fire department, and they brought her to our hospital. So when I peeked my head in with the Cavalier King Charles Spaniel, whose name is Kobe, her eyes lit up. And she said, oh, she loved dogs. So I sat there and chatted with her. But again, it was the dog connection, but it was also the connection with another person, that it was eye-to-eye contact. There was touch there. There was somebody who's caring for her, because she was alone, in fact, on this trip and this journey, and ran into a significant health issue on the way. And so that made her experience better.
Right,
so
and you're
just
right
that touch
about the alone part, because I find that when patients are in the hospital, they're afraid, and they very often don't have anyone to verbalize that to, because they're trying to keep a stiff upper lip for their family. They don't want, their family is afraid, so they don't want to burden them with their own fears. And there's a real sense of isolation and being alone, and it makes a big difference when you make that eye contact and even the touch. I laugh because some of my patients call me like the hugging doctor.
Oh,
because
that's great.
you know, patients will come in and they're going through something, and either they'll cry or they're just having, just like a difficult time of whatever issue it is. And sometimes I'll get this overwhelming feeling like, oh, you need a hug. And I can't tell you how many times I hug someone and they actually grab onto me and they're hugging back, and they'll say things like, God, I really needed that.
Yes.
Like, we've lost that contact of hugs.
Of hugs and touch. And the sicker the patient, the less they're touched.
Yes.
And so patients develop skin hunger, touch hunger. And so when we touch them therapeutically with this gentle touch therapy, you can just see that they're just soaking it up like dry wood soaks up oil. In fact, we teach in integrative medicine, we teach the patient care associates and the other nurses how to do this gentle touch therapy. And one of the patient care associates shared with me yesterday, she said, it was magic. She said, I went into a patient's room who was very, very angry, and I offered her this gentle touch of her hands with this gentle hand massage, and immediately she thanked me and she smiled and she wasn't angry anymore. She said, this is magic. I said, that's perfect. We love it.
And it's true, because sometimes they'll say that all this integrative stuff is like magic and all that. But you know what? It's a good magic.
It is a good magic.
And it makes really a big difference in not only your hospital stay, which in itself can be horrendous and scary.
Yes.
It makes a big difference in your actual stay, but it makes a big difference in your recuperation and your healing and how well you get and how fast you get better.
True. And then we have some patients who are in the hospital for quite long periods of time. And this integrative medicine session is just a highlight of their day. They'll share with me, I was waiting for you to come.
Right.
This is the high point of my day here. And so when they go home, it's not just a long stay in a hospital. It's been broken up with energy work if they want one day, or reflexology another day, or a gentle hand touch another day. If their back is bothering them, the gentle touch on the back with some oils as well. And so they move through the day with a visit from the pet therapy. Even the art in the room now, we have an expressive art.
Talk about that, because I love that. That's
the
really
art card
very
program
cool.
is wonderful. We have made some special frames in all the patients' room that open up, and we can change the prints. We have over 50 prints that the patients can choose from, so they can have exactly what they want in the room for them to look at. And even going into a room, I'll say to a patient, do you like this picture? They say, I was staring at that all night long. I absolutely love it. Or I can use that as a focal point to help a patient relieve their anxiety and say, oh, look at those beautiful rows. Can you imagine yourself walking down that lovely row of lavender there? Here, we'll put a little lavender in your pillow, and you can even imagine that you're there, and you can feel the wind blowing and feel the warmth of the sun as you walk through those fields. Take them out of the room for a little bit. Give them a little vacation from their hospital stay.
And it's not something that, it's something anyone can do.
Yes. And that's what we do. We train staff in using therapeutic suggestion, guided imagery. We train the staff in the energy work. We train them in the gentle touch therapy. And we have some staff that are trained in reflexology as well. I offer aromatherapy workshops for the staff. And I have some wonderful volunteers from the community who know energy work, who have come to me, found me, and said, we really love to be part of your program. And I embrace them with open arms and say that is wonderful, because we are so popular. We see over 250 patients on a monthly basis. And so the use of volunteers in the program, because our program is funded very generously by philanthropy. And so the use of volunteers is a very, very important key piece of our program as well. So they come in, and I will see patients, and I will introduce patients to them, and they will stay and do some energy work with them. Or they'll go around to the infusion area where patients are getting chemotherapy and go down the row and offer the patients some mandarin to help them with nausea and vomiting, or some lavender to help ease their anxiety as well. So, but getting back to the art program, this is a wonderful program. The patients call up and say, can I change my picture, please? I really like that picture of that beautiful scene. It reminds me of my home in Pennsylvania. I can see it just going down the driveway there. My home's at the end of there. So this is another addition. We have an expressive art program, too, in the Cancer Treatment and Wellness Center, which has won a National Best Practice Award from the Plane Tree Alliance, just as the Integrative Medicine program has also as well. And this is where the patients will, as a collective group, engage in coloring or painting in perhaps a mandala. A beautiful series of concentric circles, and they'll paint a little piece of it. They'll take one color and say that this color is very important to them, and they'll tell you why it's important to them. So not only are they expressing themselves with color, but they're also releasing and verbalizing what's inside and what needs to come out as well. And we do have one that was created by 32 different patients, a mandala that hangs right now in the imaging room in the Cancer Treatment and Wellness Center. So we have some wonderful programs outside of the integrative medicine program that deals with the patients' inpatients. We also have a yoga program for cancer patients and a Pilates one-on-one program that we partner with Body-Wise Connections in Chappaqua, where Pilates instructors come in and help patients after breast surgery to help them heal, to show them that their bodies have not really betrayed them, that they can use their muscles and function well at the end of it. So integrative medicine is becoming part of not only the inpatient population, but the outpatient population and the community as well. Every week we offer meditation groups, and we have about 10 to 15 regulars who come in and sit with Ann West and meditate and share for about an hour of time. And that's another part of the program that keeps the community members involved in the hospital and keeps us in touch with what's going on in the community. We have drumming circles.
Right.
Yes, one of my favorites. Health Rhythms drumming to promote wellness, to relieve tension and stress, to promote team building. And this is done on a monthly basis as well. Natural Awakenings, the magazine, had their monthly group. We had a drumming circle of over 20 people, a very enthusiastic response to the drumming circle. And sometimes I'll even use drumming if perhaps the yoga instructor can't come for the cancer patients during one of the Saturdays. I'll substitute a drumming circle, and that's been very well received as well. The ladies who come just absolutely love it.
Now, there's so much that's being done, and all under the umbrella of patients.
Yes.
And making patients feel better, and even people who are not patients, because they actually are very supportive to family members, because the family, as the caregivers, are also undergoing a very difficult time with their loved ones. And the cooking sessions, I thought that was something that was very cool, how to cook, and then showing the caretakers how to make healthier meals for the patients undergoing chemo and patients with cancer. There's a lot. There's a lot.
The caregiver, it's very important for the caregivers to be involved. And also we will support caregivers. We'll offer caregivers aromatherapy or energy work. And we come into a room and we leave and everybody is smiling. It's a wonderful thing.
Yeah, and I can tell you, the work with the caregivers, it makes a big difference, because recently I've been the role of the caretaker, and there were days where I just thought, oh my God, I am going to just explode, because you're really trying to make that person be their advocate. It's not easy, and to include them is amazing.
Yes, and we do have a wonderful caregivers center at Northern Westchester Hospital, and again, it's staffed by a social worker.
Well, Karen,
Oh,
thank you. This was so much.
We could go on forever.
I know. Thank you so much. And this is Karen Maier. She's the head of the Integrative Medicine Department at Northern Westchester Hospital.
And we need a hug.